the MCQ, tomorrow quiz answer sheet. So any queries about this?
No.
I think not. So we will start at 9 o'clock. No? Okay, stop sharing. So another one is a tutorial. No? The tutorial. Okay, after tutorial, I will let you know about the practical component. No? So we'll start with tutorial. Tutorial is, if you have some question regarding with my lectures, previous 5 lectures, you can ask me now, or you can WhatsApp me. So if you want to ask me, you can ask me now. So you can think of if there are any questions or not, and I have to introduce that, revisit the filariasis, filaria worm. I think Dr. Lim already finished anti-filariasis, the drugs used in filaria infection. So previously, filaria, this topic is one lecture, complete one lecture. But because this year, now we updated our curriculum lecture topics in hemobiotic system. Now we are going to infection of the RBCs, infection of the WBC maybe lymphocytes, and the infection of the phagocytic cells. We go by infections according to the cell. So endothelial cells, circulation system. So the filaria worm is missing. So that's why I took the tutorial on the filariasis. So you already know that filaria are worms. They are parasites. So these parasites live in the tissue, not the intestine. So they are tissue nematodes. Their worms are nematodes. The worms may be nematodes, cesto, and trematodes. These filaria worms are nematodes. All right, so causing infection is filariasis. There are many filaria worms. But for hemobiotic system, we focus only in the related to the blood and circulation. So we focus only on those microfilaria found in the blood. So others we already study in year 1, right? So yeah. So why filaria topic is included under hemobiotic system? Because of the presence of microfilaria larvae in the patient blood. So not because of the adult worms. Adult worms, male and female adult worms, live in the lymphatic system. So this is for lymphatic filariasis. In case of lower, filaria worm, so microfilaria also can be found in the blood. But the adult worms live in the connective tissue, skin connective tissue and conjunctiva. That's why the lower another name is the eye worm. Eye worm. So you can see adult worm sometimes crossing the conjunctiva when you are examining the slit lamp examination. So eye examination under the microscope. Magnification power. Sometimes moving adult worm is crossing the conjunctiva. So that's why their name is eye worm. Okay, so that's not because of the presence of microfilaria larvae found in the blood. So this topic included under hemobiotic system. So here, Wucheria bancrofta, Bruchia malai, Bruchia. Wucheria, Bruchia lower. Lower. Species is also lower. So these 3 are only included under hemobiotic system. So if the questions, if I ask a question, I will ask only on this component, not here, because this is not under the immunobody system. So, all right. So, the most common one is in lymphatic filariasis. Lymphatic filariasis means the adult worm live in the lymphatic system and lymph node. So you see here the adult worm and larva form. Adult worm is lymphatics, lymph nodes, mainly in the lymph nodes. So here lower is on the conjunctiva or connective tissue. So that's why the infection caused by Wucheria and Bruchia are known as lymphatic filariasis. All right. So vector-borne, all the filarial infections, filariasis are transmitted by the vectors. So there are vector-borne diseases. So what is a vector? Vector is a mosquito, or maybe some are not mosquito. Lower is a crabsop. This is not the mosquito. So for lymphatic filariasis are mosquito. Mosquito mainly the genus is Culex. Mainly, genus is Culex, and the species is Culex quincy fasciatus, fasciatus, or Culex pipens fatigans, also the same. Culex, mainly the genus is Culex, but the Anopheles, and others, even in other tropical countries, the Aedes, can transmit the lymphatic filariasis. But here in Bruchia malayi, so this infection is endemic of present in this Malaysia. So for Bruchia is Mansonia species. So Timor region, in the country Timor region, the same genus name is Bruchia timori, and this is transmitted by the Anopheles. So 3 genera of the mosquito can transmit the infection, but mainly is Culex mosquito. All right. So here you see the microfilaria, larvae. Larvae are found in the blood. So they appear in certain time of the period, on certain time only. They usually, the microfilaria, they usually stay inside the lungs, the pulmonary capillaries. But only they came out and reached to the peripheral blood, because we are taking the sample from the patient, we are taking the peripheral blood. So these microfilaria come out and reach to the peripheral blood only at night time. So in the daytime, they are sleeping. They are sleeping in the pulmonary capillaries. So that's why when you take the sample from the patient, you have to take the sample, this at that night time, 10 p.m. to 2 a.m., something like that, so during night time. So at that time, you can detect the microfilaria in the peripheral blood. So that's why there is a periodicity. Some period you can find the microfilaria in the peripheral blood. That is known as nocturnal periodicity. So that's why Wucheria, Bruchia, for these 2 genera, you have to take the sample at night time. So for lower, you can take any time. Diurnal. Diurnal is only both daytime and night time. Any time you can find microfilaria of lower, from the patient. So that one also important. So the microfilaria of Wucheria bancrofti, Bruchia species have nocturnal periodicity, right? So I want to let you know the name of the neglected tropical disease. I want to introduce this name. So this is under the WHO, World Health Organization. There is some diseases. They are not given by these, the care. No? So that is known as neglected tropical diseases. No? So one of the neglected tropical diseases and the World Health Organization is lymphatic filariasis. So 90% Wucheria bankrupt, you already know that. No? 10% are Brugia. No? So how the infection transmitted? By the bite of the vector. No? The Culex. No? So you already know that infection, transmission is, even though mosquito-borne transmission, the mode of actual transmission of the disease agent is different. So in malaria, the sporozoites are injected by the mosquito. In case of filariasis, the larvae are not directly injected into the patient. Just they break the proboscis of the mosquito, the proboscis sheet, break the proboscis sheet, and then they are deposited on the skin. And then from the skin, because of the skin temperature and humidity, they migrate and they go into the puncture wound. So not directly injected like sporozoites. So this is just a revision. So this is the life cycle. So adult worms, male and female, you can say male and female because of nematodes. If it is cystode and trematodes, you cannot say this is male or no separate gender. So because of nematodes, tissue nematodes, the male, female, adult worms, they live in the lymphatic system, mainly lymph node, because of their long and big size. So they live mainly in the lymph node, inguinal lymph node, mainly here. So lymph node, and then because of separate sex, male fertilized female and gravid female, produce their larvae. So that's why they are viviparous. They do not lay the eggs. So that is not oviparous. They directly give birth to the larva. So that is viviparous. So they give birth to microfilaria, and then these microfilaria, they live in the pulmonary capillaries bed, and then they go to the peripheral circulation. So when they are peripheral circulation, mosquito bite inside the mosquito, they develop into larva form, larva L1, L2, L3. So L3 larva is infective form to human. Microfilaria is infective form to mosquito. So both are larva stage, but different majority. So the form goes into the mosquito is microfilaria, sheet microfilaria. So first in the mosquito, they remove out the sheet, and then develop into L1, then major into L2, then L3. So after L3, they migrate to the mosquito proboscis nearby there. When mosquito bite it, this component is known as proboscis. So they live in the proboscis. When bite the human, if by the infected mosquito, these larvae break the proboscis and then deposit it on the skin. So that is the life cycle. Okay. So if you know the life cycle, you know the clinical features. So what are the clinical features? One is due to the adult worm in the lymph node. Number two is presence of the microfilaria in the circulation. So mainly signs and symptoms are due to adult worms in the lymphatic system. So this condition is known as classical type of filariasis. So in case of classical filariasis, usually present with the lymphatic system. So lymphangitis, finally lymphatic, because of the inflammation and lymphopharynx, lymphedema, and then lymphadenitis. So these signs and symptoms are related to the adult worms, not because of the larva, not because of the microfilaria. So that's why, lymphatic, complications, lymphatic blockage, of the complication. not like the elephant leg, no? Because of the blockage, no? This is due to the adult worms, no? Complication caused by the adult worms, no? So elephantiasis or elephantiasis. Okay, so what about microfilaria? So microfilaria causes occult filariasis. Occult means hidden, no? Only hidden infection. No? So this one is sometimes you can find occult type, mostly classical type, no? All the signs and symptoms of lymphatic system. But sometimes, no, in some patient, no, because of the hypersensitivity reaction, no, to the microfilaria antigen, no, host response, no, to the microfilaria. So in this case, patient can present with no hypersensitivity type 1, like type 1. Actually, okay, for microfilaria is hypersensitive reaction. So sometimes, like a bronchial asthma, especially in tropical country, if it is the bronchial asthma, cannot, if a patient, you have to, because bronchial asthma patient also present with eosinophilia, so that's why if you see massive eosinophilia, because in occult filariasis, eosinophil count very high. That's known as a condition of tropical pulmonary eosinophilia. So eosinophil count in the blood is very high, and patient present with bronchial asthma or tuberculosis, now you have to screen for the microfilaria. So this is because of the host immune response against the microfilaria antigen. Also here you see serum IgE also high. So these are known as occult, this condition known as occult filariasis, that is caused by the microfilaria in the blood. So microfilaria, mainly classical. All right. So this is about the diagnosis. In case of, if you think, if you suspect this is a case of lymphatic filariasis, you must ask the patient to collect the urine. So urine here, so because of the lymphatic system, the inflammation and lymphatic ducts, the ducts dilated, finally ruptured, leaking the lymph into the urine. So that's why in the urine, you will see the chyuria, presence of the blood in the, presence of the lymph in the urine. So white color. If the patient urine is like this is the characteristic, diagnostic features of the lymphatic filariasis. Right? Sometimes hematuria, hematuria and lymphuria combined like this, very turbid, because of the lymph. And then also pink color is because of the hematuria. Okay. So this is a what is diagnosis? Because I delete many slides. So how will you diagnose? So specimen is peripheral blood. So because adult worms are live in the lymph node, so you cannot take the sample of the lymph node. So mostly for the lymphatic system inflammation, you can take the sample of the urine from this patient. Or for the diagnosis aspect, you have to take the sample of the peripheral blood at night time because of the nocturnal periodicity. If you can find, if you don't find, you are very suspicious this is a case of lymphatic filariasis, the sample show negative, you need to repeat the sample up to three days, consecutive 3 days. Because when you are collecting the sample, the microfilaria are not in the peripheral blood, so that you have to repeat the sample, take the sample, next day, another day, up to 3 consecutive days. So how will you identify the microfilaria? Now you have the peripheral blood. So the most, the fastest diagnosis is, you take the sample of the blood, put it cover slip. If there is microfilaria, you can see moving microfilaria. Moving microfilaria on the under the microscope with high power objective. No, even though low power objective you can see. No, this is the snake-like structures. No? So staining purpose, no, you can make a blood film, no, like malaria parasite, no, blood film preparation, and then stain with Jameson stain, no, so that you can find the microfilaria, no, or in snake-like structures. No, this one is for the detection of the organisms. No? So you can detect the antigen, no, filaria antigen rapid test, no, very easy to prepare, no, perform, no, just take the sample of the blood and then put it on the cart. No? Why is it? No, this is a cart. No, you can open this one. No, like a booklet. No, and then put it on the sample. Put sample on the strip, and then put the reagent. No, and then close the cart. If there is infection, so you will see that 2 bands. If it is no infection, no filaria antigen, you will see only control band. No, this is control, T for test. No, control for a C for control. No, if it is positive, you will see 2 bands. If it is negative, no, control band only positive. No, that one you can get the diagnosis within 50 minutes. No? But the issue is you can tell the patient this is a case of filariasis, but you cannot differentiate active infection or previous infection, or so, because filaria worms are in the lymphatic lymph node for up to the lifespan is up to 7 years. If they are in the lymph node, they will produce the antigen. So if there is filaria worms, they will produce the positive test. Okay, so if it is microfilaria larva, so when not in the blood, so you will see like this snake-like structure. No? So snake-like structure and sheet present. No, microfilaria in the blood. No, all are sheet. No, with lined by the sheet. No, here. So these are somatic nuclei. No? So if you examine under the wet flame, under the wet flame, you will see live microfilaria. So they will move. If it is in the blood flame, and stained with heat and or they all die, right? So in this case, you will see the staining of the somatic nuclei. These are nuclei, and then you cannot see the movement of the microfilaria. So if you see the sheet, you can see this is sheet microfilaria. So what are sheet microfilaria? Wucheria, bruchia, and lower. So you can differentiate the species. If you identify this tail end of the microfilaria, maybe under Y immersion lens, you will see somatic nuclei very big. And then you have to look at the tail ends. If the tail ends have no nuclei, so this is Wucheria. If you see 2 nuclei, that is bruchia. So if there is nuclei and not up to the tail end, this is a tail. This is a sheet. This is the tail end of the microfilaria. The body and tail. So if the nucleus is until the end, so that is lower. So by looking at the position of the somatic nuclei, you can diagnose blood microfilaria. Okay, so that is about diagnosis. The treatment, I think Dr. Lim already covered DEC, ivermectin, albendazole. So these are 3 drugs. The combination, usually you use combination, especially because of the neglected tropical disease. The WHO has already ongoing process of elimination of filariasis. Elimination, not eradication. So elimination means that they reduce the disease level, that can not transmit. They cut off the level, that cannot be transmitted. So that is elimination. So eradication is no more cases. So for filariasis is elimination. So for not that elimination, in some countries they are using mass drugs therapy in the endemic area. Combination of DEC, ivermectin, albendazole, maybe 2 or 3 drug combination. All right, this is about the tutorial on filaria. Okay, so this is a type of revision, or you have studied in the year 1. So for practical purpose, so practical, I will give you the assignment. The assignment related to the protozoa, blood protozoa. So for this assignment, I will send you the questions. And then you need to submit me next Tuesday. So because tomorrow is exam, you will have the weekend, Saturday, Sunday, Monday. You take 3 days and then send me on Tuesday. Okay?
Okay, doctor.
All right. So this is about hemoprotozoa, hemoprotozoa, discussion on hemoprotozoa related to the life cycle, clinical features, transmission, diagnosis in aspect. So don't copy and paste, from your colleagues as well as from the internet. Not just you find out and write your own ways. Okay, so another one, I have to, I want to do a survey. So can you show your camera? All of you, can you show your camera? I want to see your face because I need to let you know about my survey. For 5 minutes, can you show your camera on? All right, thank you, Alpha. Thank you, Hazila. Shaira, Onet, all, thank you, Siverni. So I want to do a survey for PBL, contact of PBL, problem-based learning. What is your perception, the perception of contact of PBL?
Doctor.
All right.
Is the survey going to take some time?
You can do at home, your time.
No, what I mean is because we have like 3 minutes left.
All right.
Okay,
I need a little bit 10 minutes to explain you. So you off and then join again, okay?
Assembling that, yes.
Because now it's 3 minutes. It's not enough time.
Okay.
10 minutes. 10 minutes.
I will start again using the same link. Okay.
You can upgrade. You can upgrade.
No. No,
Maybe some students are not joining. I think only 11 students. No problem. INAM is connecting. Okay, so okay, so the survey is related to your PBL. Related to your PBL, PBL, contact of PBL. So we have contacted PBL, many PBLs, according to the system. Then what about your perception? The perception, your feeling. So based on the questions, there are the questions related to your perception. No, so you have to write. You have to choose. No, agree or not agree, or strongly disagree, or neutral. No, so so I will show. Oh, sorry. So, Akil, can I share the slides?
Oh, okay. Wait. Okay, done. Okay.
Okay, this is a questionnaire or survey. No, the survey. Just explaining you. No, you can do at your home or no, or weekend is okay. So the student ID, actually this survey is anonymous. No, you can, if you want to write your ID is okay. If you don't write, no, it is anonymous. So you can leave it this no name or that one. Not this is the optional. No. So the male, female, you delete one. No? So education qualification at the entry of medical program, so A-level or foundations or no? So if it is not relevant, you delete it. No, this is a word form. No, and then what? No, the criteria is no look at criteria, and then this one strongly disagree is one. No, one is the lowest level. No, disagree 2, neutral 3, no, 4 is agree, and 5 is strongly agree. No, you will get this form. No, then for example, number 1, no, you copy this one, very easy. You copy it, and then now if you think this one is correct one, you paste it no, in one box. No, for one question, only one click, no, one tick. No, so don't answer 2. No, so based on your feeling, you can answer. No? So motivate the student for self-learning. Now PBL, this is related to PBL. No? So this PBL class or PBL experience no, make you motivation for the self-learnings. No? So if you agree, so you click for. If you strongly agree, you click this one. No? So this is a way of answering. No? So there are a little bit questions, very easy. No? So provides a problem solving skill, no? Something like that. No? But I want your true feeling, true perception. No? Don't take no or and no number 3. So usually neutral is very difficult to differentiate. No, so I want to have your true feeling or true no perception from you. No, that is my sincere request to you. No, and based on this data, your data, so we may have some modification no, of the current contact of the PBR. No, so this one is no perception on online PBR. No, because the whole the semester 4 is the whole online class. No, so the online class, how you feel it, no, how you feel it. No? But there are questions, many questions, but very easy. No, so you can give the some comments. No, something like if you feel you can write it. No, so internet access is good in campus. No, so actually the questions are 30 questions related to the no PBL survey. No, the others are no, here is because of the online. So asking about if there is something wrong here, so we have to adjust with it. Is it because of internet problem or something like that? No, this is related to the online platform. No, so because of the not expert user of the the IT problem or online tools or no? So that is these are about online, no Wi-Fi, no IT problem. No, this is about PBR. Okay, so you will get 2 survey forms. No, this one is for online, no virtual PBR. So in semester 3, you also have experience with face-to-face, right? Respiratory system, nervous system, So at that time, no MCO, right? So you have also have the feeling, the experience of face-to-face, no normal classroom. So So another question now is the same question, the perception on face-to-face PBR. So answer, give me your perception, true perception on that. Is there any difference or not? I would like to know. And then, this is based on this data, we can do some modification. It is for the students, not as well as for the lecturer, right? So please, I request you to involve this survey, not all of, because you only have 20 students, the sample size is very low actually. So I have conducted the PBL survey in my experience at other university. The previous university I worked 6 years. So I also have this survey on PBL. So here is I'm comparing how differ the face-to-face contact of PBL and online, the virtual PBL.